If you're a woman undergoing fertility treatments, you may be prescribed Fyremadel 250 mg/0.5 ml Subcutaneous Syringe Lhrh, Gnrh, Antagonist, Pituitary Suppressant Agents. This medication is often used in combination with other hormones to help with controlled ovarian stimulation. Fyremadel works by blocking the release of a certain hormone, luteinizing hormone, which can help prevent eggs from being released too early and allows them to grow properly. It's important to follow your doctor's instructions for the correct dosage and timing of this medication to get the best results. Before starting to use Fyremadel, it's important to read the patient information leaflet from your pharmacist and ask your doctor or pharmacist if you have any questions. It's essential to learn all preparation and usage instructions from your healthcare professional and the product package. Before using, visually check the product for particles or discoloration. If you see either, do not use the liquid. You should inject this medication under the skin as directed by your doctor, usually once a day for several days. It's important to carefully follow your doctor's instructions on when to start and stop this medication. Before injecting each dose, clean the injection site with rubbing alcohol and change the injection site each time to minimize injury under the skin. It's crucial to use this medication exactly as directed by your doctor to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Lastly, make sure to learn how to store and discard medical supplies safely. As with any medication, there may be some side effects to be aware of. These can include redness or pain at the injection site, headache, mild nausea or stomach pain, and tiredness. If any of these effects persist or worsen, it's important to speak with your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's important to be aware of them. If you notice any serious side effects, such as unusual vaginal bleeding, it's important to inform your doctor right away. Additionally, this medication may cause a condition known as ovarian hyperstimulation syndrome, OHSS, which can lead to fluid buildup in the stomach, chest, and heart area. If you experience severe pain or swelling in the lower abdominal area, severe nausea or vomiting, rapid weight gain, or decreased urination, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to be aware of symptoms such as rash, itching or swelling, severe dizziness, and trouble breathing. If you notice any of these symptoms, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. And if you're in the US or Canada, be aware of the resources available to report any side effects. Before starting Gnrh, make sure to inform your doctor about any allergies you may have, especially to gonadotropin-releasing hormone, Gnrh, or other related products. Also, discuss any medical history with your doctor or pharmacist. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. It's important to be aware that using this medication may lead to multiple births. If you have any concerns or questions about this, consult your doctor for more information. If you become pregnant while using this medication, stop using it immediately and inform your doctor. This medication should not be used during pregnancy. It's not known whether this drug passes into breast milk, so it's recommended to avoid breastfeeding while using this medication. Consult your doctor before breastfeeding. When using Fyremadel 250 mg/0.5 ml Subcutaneous Syringe Lhrh, Gnrh, Antagonist, it's important to be mindful of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency medical assistance immediately. In the United States, you can reach out to your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center for assistance. It's important not to share this medication with others, as it is prescribed specifically for you. Your doctor may conduct lab and/or medical tests while you are using this medication, such as vaginal ultrasound, hormone levels, and liver tests. It's important to attend all medical and lab appointments as advised by your doctor. If you have any concerns or questions, make sure to consult your doctor for more details. If you forget to take a dose, it's important to consult your doctor or pharmacist to establish a new dosing schedule. It's not recommended to take a double dose to make up for the missed one. When storing Fyremadel 250 mcg/0.5 ml Subcutaneous Syringe Lhrh, Gnrh, Antagonist, Pituitary Suppressant Agents, make sure to keep it at room temperature away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When you no longer need this medication or it has expired, make sure to properly dispose of it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.